Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Governor of Ekiti State, Kayode Fayemi, receives report on fumigation exercise which sent over 100 people to hospital with varying degrees of inhalation complications. British Consul donates personal protective equipment and other items to voluntary policing group in Yobe State. And Delta variant dominates transmission in Indonesia as hospitals fill up in situation described as close to a catastrophe. As at today, Africa has recorded over 5.3 million cases with a death toll of over 140,000. The federal government is monitoring some African countries who are experiencing a spike in COVID-19 cases. And due to the variants of concern and dangers associated with the importation into the country, the Presidential Steering Committee, PSC, has announced additional measures, including the extension of the ban on flights from Brazil, Turkey and India, updating the list to include South Africa as well. Meanwhile, according to the Nigeria Center for Disease Control, the country has recorded less than 500 cases in 2 weeks. However, 11 states out of the 36 states and the Federal Capital Territory have no case on admission, while 5 states reported 65 new cases yesterday. Let's take a look.
The Nigeria Center for Disease Control recorded a significant increase in the number of infections in the last 24 hours as they announced 65 new cases reported from 5 states across the country. Lagos had the highest with 44 new cases, followed by Yobe with 10. 5 cases were recorded in Rivers, while Oyo and Kano recorded 4 and 2 cases. The latest report includes 14 cases recorded in June 27th and 30 cases recorded on June the 28th from Lagos State, while 0 cases were reported from Ekiti, Imo, Gombe, Ogun and Plateau states. Total number of confirmed cases now stands at 167,532. 35 people have now been discharged after testing negative to the virus, raising the total number of recoveries to 163,984. There were no casualties in the last 24 hours, leaving the fatality toll at 2,119. Presently, there are 1,429 active cases in the country, while over 2 million samples have been tested so far. The latest update by the National Primary Healthcare Development Agency shows that more than 2.2 million eligible Nigerians have been vaccinated with the first dose of the Oxford-AstraZeneca vaccine, while over 1.1 million of those vaccinated with the first dose have now received their second dose. Lagos State is taking the lead as it has now vaccinated more than half of its eligible population, followed by the FCT, Kaduna, Kano, and Oyo states. The agency also announced more updates from the ongoing vaccination exercise and the country's response to COVID-19 at a recent media briefing of the Presidential Steering Committee. In Africa, there are over 5.3 million confirmed cases of COVID-19 and more than 140,000 deaths on the continent. Across the world, there are now more than 181 million confirmed cases, while deaths have surpassed over 3.9 million.
The Ekiti State Governor, Dr. Kayode Fayemi, has frowned at the breach of due process by the Federal Fire Service that carried out the harmful COVID-19 fumigation at the School of Health Technology in Ekiti State. The state government is also assessing the impact of the pandemic on children. Our correspondent Babajide Agbeyo tells us more.
Governor Kayode Fayemi has received the report of the panel of inquiry set up over the controversial COVID-19 fumigation at the Ekiti Health Institution. The governor notes that the ugly development has made it imperative for government to review the protocols of engagement with federal institutions. He says it is out of order for the Federal Fire Service to storm an institution within Ekiti State for a fumigation exercise without duly informing appropriate state authorities. Meanwhile, the state government has been assessing the impact of COVID-19, especially on children. From government's assessment and recommendations, priority will have to be given to child-centered services and other relevant support initiatives.
How do we begin to reverse this impact COVID-19 on children. The first thing to think about is to continue to prioritize child-centered services with a particular focus on equity of access, particularly in relation to schooling, nutrition programs, immunization, and other maternal and newborn and community-based child protection programs. The second is to provide practical support to parents and caregivers, including how to talk about the pandemic with children, how to manage their own mental health and the mental health of their children, and to provide the necessary tools to support children learning.
The implementation of the recommendations should, to a large extent, mitigate the impacts of the pandemic on children and schools. Babajide Agbeyo for COVID-19 update.
As the world combats the pandemic and in an effort to provide safety for groups supporting frontline troops in northeast Nigeria, the British Council has supported the region by donating COVID-19 personal protective equipment, among other items, to voluntary policing sector in Yobe State. Receiving the items, Governor Mai Mala Buni, represented by his deputy Idibade Gubana, says the donations of the items will go a long way in supporting the group to be more proactive.
Since the outbreak of the coronavirus in Nigeria, Yobe State is one of the states with the least number of infections, with a record of 478 confirmed cases and 9 deaths as at Sunday, June 28, 2021. As part of measures to curb any further spread of COVID-19 in the state, the British Council is donating personal protective equipment to state voluntary policing sector.
We presented face masks, hand wash items. The items contributed are not, or donated are not only COVID-19 items. The items donated include quite a number of raincoat, boots, working boots, rechargeable torchlights and battery-used torchlight.
For the state government, the safety of residents remains a priority. The Deputy Governor of the state commends the British Council for the donation.
We express our appreciation to the British Council for identifying with the effort of excellency in selecting some youth and some elders as a special task force on security challenges we have, for identifying with us and then giving us this donation of items to boost their morale, to ensure they set their duties according to the rules of engagement.
It's a gesture the beneficiaries are thankful for.
As a matter of fact, we're grateful whenever we are given working tools or equipment. This will boost our morale at all times. Therefore, we are very grateful.
The items donated include face masks, hand sanitizers, rain boots and coats, among others.
Is Nigeria prepared for a third wave as efforts around the world are being made to prevent and manage the global pandemic? Well, joining us in the studio is Professor Richard Agbola, Consultant Research Fellow with NIMA, who joins us now on the program. Thank you for joining us.
Thank you for having me on your program.
All right, let's look at our current approach to the management and our COVID-19 response in the country. Is it sustainable to address the threat of a third wave? And this is seeing as yesterday the PSC added South Africa to the red list countries.
We have to be vigilant is the response to that, and change our views and the system that we put in place as we have more information. I think what we have in place now with regards to restriction from countries where they are having problems is probably okay. But what are we also doing inside the country with regards to vigilance, testing on time, following up on those who may have the disease, isolation if it is necessary? All those rules and procedures that are in place, we still need to be followed strictly to ensure that we don't run into difficulties.
So what is our challenge? I mean, we're saying we're doing 2.3 million samples tested so far.
We are not testing enough. It's very difficult to draw conclusions from the number of people that we are testing. Now, from 200 million people, we've tested only 2.3 million. So making generalizations about COVID-19 data in Nigeria is actually a problem. But we're doing the best that we can with regards to the capability in the country in terms of people who will do the testing and the reagents and equipment that are required. So I think with regards to what the situation that we face, we're doing the best that we can.
So the Nigeria Center for Disease Control says states need to take this responsibility, so nationals are supposed to take this forward. But how do you essentially balance all of that with what other sectors states have to battle with, and then, you know, COVID, which also fuels the fact that some people feel it's a virus that doesn't really exist in the country?
Well, that's the major difficulties in Nigeria and some African countries as well. The denial of what is happening. And we need to increase efforts at making advocacy to make sure that we are not out of it yet. COVID is real, it's killing people, and we must do everything that we need to do to avoid it. We certainly don't want to have another lockdown in Nigeria, because it's not only the impact that you have on disease, but on people and livelihood. Taking into consideration the kind of economy that we have in Nigeria.
So let's look at vaccines. We hear more are promised in September. I mean, this also limits our success in bringing the pandemic under control, seeing as the number that we're getting. I believe the federal government says 29.8 million doses Johnson & Johnson, in addition to the 3.92 million of the AstraZeneca we're expecting.
That is, as you probably know, vaccine inequality, global vaccine inequality is a major issue that is being discussed time and again. I'm not quite sure I know who to blame for that, because have we been preparing for that before now? But it's good news. Whatever amount of vaccine that we have to get more people vaccinated must be regarded as good news. But 2 point something million is still very low. If you take into consideration the fact that you need to vaccinate 60 to 70% of Nigerian population to begin to have community effect, so that's a still low number. But then we also have problem with people who don't want to receive even what we have. So we have a lot on our plate to do in terms of making people aware that if you have the vaccine offered to you, please receive the vaccine, because it can save your life.
So now that you've said that, we'll also have the issue of the COVID brand of the AstraZeneca. And we understand that the EMA, European Union, has said it's not part of what is agreed for the Green Pass. Some people have been speaking about the efficacy of COVID, which developing countries and India, received. What's your take on that?
So efficacy of so I need to talk about efficacy, which is a scientific attempt to know the quality and the effect of a vaccine or a product. And what you do is prioritize or optimize every conditions around the study so that whatever effect that you get is the vaccine. That's not real life. That's not what happens when you introduce vaccine to the community, where other factors come into play. With regards to efficacy of the vaccine, it's a shame it wasn't done in our country, but there are data to suggest that the vaccine is efficacious, as it has been reported. Whether it's going to produce that when you now introduce it into a general community like the population, that needs to be examined again. The real world effect of the vaccine under use. I know that with regards to the vaccine that's been given in Nigeria, there are attempts to do that. But then there's a difficulty. You cannot vaccinate, evaluate effectiveness of a vaccine in a community, in a population where less than 2 million have been vaccinated. Even that, the concentration of the vaccinees are amongst this particular group. What they are trying to do at NIMA is focus on that group, the healthcare workers, and see whether the vaccine is effective amongst them. But it will be difficult to translate or extrapolate that to what will happen in the general population anyway. So
this is going to take us time, it's going to take us money as well.
Yes. The real issue actually is money. Okay. Funding research, I'm a researcher myself, and funding research is pretty difficult in Nigeria. Research to generate credible data takes money. It takes expertise, but it takes money.
Perhaps another issue, topic to talk about on the program, funding. But we appreciate your time on the program. Thank you so much. We've been speaking to Professor Richard Agbola, Consultant, Research Fellow with NIMA. Thank you for joining us.
My pleasure. Thank you.
Well, the global update on COVID-19 is still ahead. Please stay with us. According to the World Health Organization, the third wave is picking up speed, spreading faster and hitting harder. With rapidly rising case numbers and increasing reports of serious illness, the latest surge threatens to be Africa's worst yet. This is coming on what's happening in South Africa. Well, joining us right now is Professor Jeffrey Mfalele, Vice President, Research, South Africa Medical Research Council. He joins us via Zoom. Thank you for joining us on the program.
Thanks for having me.
All right, Professor, tell us, what is the science and the data saying about South Africa's COVID-19 situation now?
Well, South Africa is in the exponential phase of cases, the third phase, the third wave of COVID-19. And this has just, started a few weeks ago. And it started in some, selected regions, and it seems to be, a trend nationwide now. But even if, most regions or provinces in the country are picking up cases, there is just one particular province, which is the economic hub of the country, Gauteng province, which is accounting for more than 60% of cases on daily basis in the last 3 weeks.
And the president said in his broadcast that this is a devastating wave. Do you expect that it will get worse? And what is the major cause?
I think what we see with the third wave is that we have got our normal virus strains circulating, the beta virus, but recent data has indicated that the Delta variant, which was initially detected in India, is also gaining momentum in South Africa. And at the moment, we have got at least 5 provinces where the Delta variant has been detected. There was one province, the province of KwaZulu-Natal, where they have done random sampling of different sites, and they've shown that actually the Delta variant is slowly displacing the Beta variant. And the data from the Western Cape is also showing the dominance of the Delta variant. We are waiting to see the data from Gauteng province, which is driving the third wave in South Africa. But the expectation is that the Delta variant will also be responsible for these cases in Gauteng province.
How much is the number of vaccines coming into Africa and then South Africa affecting the spread of the virus?
Well, the vaccination coverage is still very low, very much like what you see in other African countries. We have only vaccinated just below 3 million people in South Africa. And as you can, if you know, we started with healthcare workers, frontline healthcare workers, and then the elderly. And now the education sector is also getting attention in terms of the vaccination. So the pace of vaccination is not going according to the initial plan due to global shortage of vaccines. So it will take some time before we really reach a level where we will be able to intercept or reduce the number of cases in South Africa.
Indeed, the worry for countries in Africa. But then looking at the measures South Africa is taking to combat this third wave, I think it's 2 weeks, 14 days, the restrictions that have been put in place. Would you say that that's enough? Are they bound to work?
Well, these measures are never enough because the best measure is really a total hard lockdown. Unfortunately, at this point in time, almost 1.5 years with the pandemic, this is just not practical in our setting. So the president has announced some measures, and nationally there will be closure of schools as of tomorrow, so that you limit the movement of school children to schools, and obviously in the process transmitting the virus as well. And then the other area is the province that is driving the current wave. So for the Gauteng province, there is a restriction in terms of movement in and out of the province, and you need to justify why you visit the province and why you also live in the province. Unless it's for work reasons, then you have to justify. So these are just some of the measures that have been imposed. And the last one maybe that I can mention is the one on liquor, because there is temporary suspension of selling of liquor, on-site and off-site consumption.
All right, we really wish you and the government of South Africa the best in flattening this curve. Thank you so much for joining us on the program, Professor Jeffrey Mfalele, Vice President Research, South Africa Medical Research Council. Thank you for joining us on the program.
Welcome.
Indonesia's COVID-19 surge is on the edge of a catastrophe as the more infectious Delta variant dominates transmission and chokes hospitals in Southeast Asia's worst epidemic. Indonesia has reported record daily COVID-19 infections of more than 20,000 in recent days, and a new wave of infections fueled by the emergence of highly transmissible variants. Now, the country is banking on mass vaccinations to get on top of the virus, but only 13.3 million of the 181.5 million targeted for inoculation have received the required 2 doses. Here's more on the global update.
The Red Cross has described the COVID-19 surge in Indonesia as being on the edge of a catastrophe as the Delta variant dominates transmission and hospitals reach capacity. Indonesia is counting on mass vaccinations to get on top of the virus, but just 13.3 million of the 181.5 million targeted for inoculation have received the required 2 doses. After recording its highest number of daily coronavirus deaths, Russia has announced that the country will fail to vaccinate 60% of its population by autumn as planned. The Kremlin has blamed the recent surge in COVID-19 cases on the infectious Delta variant, which they say accounts for around 90% of all new cases, and on the reluctance of many Russians to get vaccinated. Over in Britain, another 22,868 coronavirus cases have been reported in the last 24 hours, the highest since January the 30th this year. British Prime Minister Boris Johnson had confirmed on Monday that there will be no early easing of the remaining coronavirus restrictions before the planned date of July the 19th. And finally, in France, the Delta variant, first found in India, now represents nearly 20% of COVID-19 cases in the country. This is up from last week's estimate of it representing 9 to 10% of cases, but only 500 new confirmed cases were reported on Monday, while the 7-day moving average of daily additional infections fell to an almost 10-month low.
We're all still vulnerable. Don't forget to protect yourself. Continue to do that. You can see our websites for more updates, also a better understanding of the pandemic. It's channelstv.com. You can find other stories there as well. Politics, breaking news, business, sports. It's all at your fingertips. And that's the program this evening. Thank you for watching. I'm Millicent Nwaka. Stay healthy.